Peter, Cobalt has had a distinguished history in diagnosis and treatment of cancer and cancer-related illnesses. Can you tell us its history and what has made it unique?
Well, Cobalt was established 52 years ago as a medical charity to support local cancer services. And over the years we've grown from being just a supporter of services to the NHS in terms of providing funding. We now provide services. So through unique equipment and funding nursing posts, research posts, we support oncology dementia services, not just in Gloucestershire, but across the UK. I think our major success has been investing in new technology, new services. So innovation really, we have a very supportive board of trustees and working in partnership with manufacturers like Siemens and Philips, we introduced new technology to the market or new services working with the NHS. And coupled with that, of course, is staff training, working with really high quality doctors to invest in services, has sort of helped us support the NHS with services they wouldn't normally have access to.
And can you tell us the difference between your charity status and your work with the NHS?
We work very closely with the NHS as a charity. Most of our patients are referred from the NHS. But as a charity, we don't replicate what the NHS do, if you like. We have different technology. So for example, we have the first open MRI, high field open MRI for patients who are claustrophobic or very large. So the NHS refer us patients from all over the UK for that service rather than investing in that. We have ultra high field mobile MRI, the only ultra high field MRI in Europe. So a scanner will go to a hospital in Huddersfield or Manchester to provide that service for that hospital. So we provide unique services to support the NHS rather than replicate what they do really. Yeah, I mean, Cobalt's been an oncology charity since 1964, supporting the local NHS with a cancer centre, funding research posts, etc. But a few years ago we realised there was a real problem in dementia diagnosis. So we worked very closely with the NHS in Cheltenham to support patients in the pathway for dementia diagnosis using very unique technology. In fact, we probably do more patients here for diagnosis of dementia than anywhere else in the UK.
These large scanners are very expensive. How do you keep Cobalt financially viable year after year?
It's very challenging to continue to innovate because diagnostic imaging is very expensive. We've just purchased a scanner for a centre in Birmingham, which has cost us 1.4 million. So, like most charities, we charge for what we do. We charge the NHS, we charge private patients, we charge them the cost of that service plus a very small margin. We're very lean, we're a very small organisation, so our costs are very low. So we can charge a very low rate, lower than most places in the country. But we also support it with fundraising. So fundraising has been crucial to the charity for many, many years. So if you want to buy the latest technology, we do have funding from our services, but also enhance that with fundraising. And the community supported us for many, many years to do that.
And how can businesses engage with Cobalt?
We work very closely with local businesses. We provide a cancer prevention and healthy living service. So our staff go out to the business, talk to their employees about the early symptoms of cancer, healthy living, etc. And that service is provided free of charge to the local community. We also support many businesses with an early diagnosis for their employees who may be sick, and that might be referrals through their GP or through physios or chiropractors. So a very high quality, low cost service with the aim to get employees back to work sooner than using traditional services. It's great to get local businesses involved, and we have lots of businesses involved with Cobalt to help with their social responsibility, and that can be from volunteering, giving us time to support our services, from fundraisings, and we have a pack we send out to businesses, and they're key to our success really, working with the local community.
And over the next 1 to 3 years, what do you hope to achieve?
For the last 52 years, we've invested in new technology. We've supported research in the field of cancer and dementia. We want to continue to do that. We've just recently installed a state-of-the-art research MRI facility at the QE Hospital in Birmingham to support ongoing research. We're just funding research nurses with the local mental health trust to look at research and dementia. We want to continue to do that, to provide new services, support local services, and provide the NHS with this state-of-the-art technology.